My name is David Glazier. Thank you for allowing us to present the study on the efficacy and safety of an alternative OnabotulinumtoxinA injection paradigm for overactive bladder, final double-blind and open-labeled results. This study was sponsored by Allergan. In the phase 3 and 4 pivotal studies, patients with refractory OAB, OnabotulinumtoxinA has been shown at 100 units to significantly reduce urinary incontinence and improve quality of life over placebo. In these studies, onabotA was injected 20 intradetrusor injections, and this was associated with increased incidence of CIC versus placebo. In 2 pivotal studies reflecting in the onabotA label, the CIC rate was 6.5%. This phase 4 study assessed an alternative paradigm injected solely into the trigone and peri-trigonal region. This is the study design, and patients were randomized 2-to-1 to onabotA 100 international units over placebo. Eligible patients could be entered into the open label period of the study. This shows the paradigm of 10 injections, 8 into the trigone and 2 into the trigonal regions versus the standard paradigms. Injections were each of 0.5 ml volume for a total of 100 international units. In total, 120 patients were randomized, 80 in the onabotA group and 40 into placebo. Females comprised 96% of the patients. The majority of urinary incontinence was urgency. After treatment 1, the number of urinary incontinence episodes at week 12, the primary endpoint was significantly lower than an alternative injection paradigm versus placebo. The right-hand figure shows changes in the number of urinary incontinence episodes per day from the open label baseline. Those patients who received onabotA in the double-blind period had a lower baseline versus those who had received placebo in treatment 1. The onset of reduction for baseline with onabotA occurred as early as week 1. After treatment 1, more patients who received the alternative injection paradigm had a 75% or greater reduction in urinary incontinence episodes versus placebo. The increase in proportion of patients receiving a greater than 75% reduction for onabotA versus placebo began as early as week 1 and persisted throughout week 12. After treatment 1, there was a significant improvement in quality of life total scores at week 6 and 12 in the onabotA versus placebo group. The MID for the iQoL instrument is 10, and the increase in the onabotA group exceeded this. In the double-blind period, 2 of 78 patients, 2.6%, required CIC. Both were male and both had BPH-type symptoms and prostate enlargement. This table shows adverse events in the first 12 weeks after treatment. AEs were predominantly mild to moderate. Urinary tract infections was most common. The incidence of urinary tract was higher in the onabotA versus placebo group, 30.8 versus 18%. Symptomatic urinary tract infections were seen in 17.9 for onabotA versus 7.7 for placebo. Therefore, in conclusion, the alternative onabotA injection paradigm targeted the peri-trigonal and afferent-rich trigonal, improves urinary incontinence episodes and quality of life. Using the alternative paradigm, incidence of CIC was 2.6 versus 6.2 using the standard injection paradigm. In this study, adverse events with the alternative paradigm were mostly consistent with the standard paradigm. The urinary tract AE rate appears to be higher with the alternative versus standard paradigm. And both patients who had urinary retention were males with BPH. The efficacy, quality of improvement, and safety of the alternative paradigm in patients receiving onabotA after treatment 2 were similar to those observed after treatment 1. Thank you.